So, welcome everybody to the November 18th Iowa Coalition meeting. And it's so lovely to see faces. I miss hugs and longer meetings so we can have time to like actually visit with people and break ugly pumpkin muffins. But so when so for today, the agenda that we have, and we're going to kind of move things around a little based on some of people's schedules that are going to present, but we're going to have a Department of Ed update, a Medicaid update, IPS update, IVRS is given an update, and we're going to meet Daniel, the new administrator, and then we're going to have a facilitated discussion about the workforce shortage and possible strategies or solutions that have been working for people and what people need around that. And then also Iowa APSI will share any updates that they have and then any other partner updates as well. So if you haven't already done so, please mark your calendars for the 2022 coalition meeting dates. We're just going to plan February's virtual because we thought even if things feel a little safer to get together in person, it's kind of a rough time of year for weather. So we thought we'd go ahead and just keep that a virtual meeting. And then hopefully after that, from May, August, and November, we'll have an in-person meeting is what we're striving for. And if you haven't been to one of our in-person meetings, I love to make these really horribly ugly, healthy pumpkin muffins that taste good. And Bill is a trooper, so he tries them, and that's kind of a picture of them. So I think we'll go ahead and get started. Kirsten, are you on?
I am.
Your beautiful face.
Here I am. Yeah. Yeah. And I have to say, I too was really happy to see the muffins and sorry to not be in person, not just because we didn't get to all see each other and be together, but I do miss the muffins.
Bring your slide up, or do you want me to do that?
If you could do it, that would be great.
Absolutely.
Yes. Thank you. So for those of you who don't know me, my name is Kirsten Lane, and I work with the Department of Education supporting secondary transition across the state of Iowa. And there are a lot of little things going on, but I'm just going to talk about three of our kind of bigger initiatives that are happening right now. So I'm going to go ahead and start talking because I don't need the slide necessarily to share, but then when it gets up there, you guys will be able to, oh, there we go. The first thing I want to talk about is the Iowa Secondary Transition Learning Community. And if you just hit enter, Amy, I think the three topics will slide in one at a time. There we go. So we have a new design to the website. So, and finally, we are able to connect it through a Google search. So it took a while for that to be able to happen. But if you put ISTLC or Iowa Secondary Transition Learning Community into a search engine, you will get our new Secondary Transition Learning Community page. We've had some really limited activity during COVID. Schools were just, as all of us were, schools were just such a hard place to navigate. And we had directive really from the Department of Ed to not put anything more out there than absolutely necessary for schools. And so we had a lot of really reduced activity during COVID with our learning community, but we are starting to add things back in now. We have added a focused learning community on self-determination, which started last week. And once a month, we will be having, we have a small group of about 20 individuals who are working with an associate professor from the University of Northern Colorado. And she is sharing resources and strategies and tools and setting it up in really kind of a train the trainer kind of way with homework in between sessions so they can try out the information and strategies that she shared with them. And so our first session was last week. That will continue through March. And we're really excited about having just a really focused group of folks working together, sharing ideas and information and learning from an expert. So we'll let you know how that turns out, but hopefully our hope is that it just becomes kind of a web, a spread of information and strategies and implementation of activities around self-determination across the state. We're also adding new webinars in the second semester that will coincide with some of our topics in Achieve, which we'll talk about in a little bit. But we have a plethora of resources rolling out through Achieve, and we're going to do some webinars to share out those resources. That will start in January. So Achieve, that's my second topic. Achieve is the new IEP system. So our current IEP system is a number of years old. It's just really not keeping up with technology and with the advances right now that are out there. And so we have hired at the Department of Education a development company who is working very closely with DE staff and staff out in the field across the state to develop a system that is incredibly intuitive, has some artificial intelligence and supports built in. It's going to be light years beyond where we currently are. Easier for families to use, easier for teachers to use, easier for students to interpret. I mean, there's just so much good about it. The rollout will begin with that in April, and it'll be a phased in kind of rollout. So if you're working in a district that is beginning in April 15th is the first date to kind of jump in. You might, if you have students in a district that is choosing that April rollout, you might start to see the new system in mid-April. And there will be several spring dates for rollout. And then everybody will be on by September 15th. So for a while, you'll see a little bit of both systems, but beginning in September, everybody will be in. Lots of PD going on within schools and AEAs throughout the spring, summer, and fall. And then there are specific, so we will be training, so regarding secondary transition. We have a development team that is working on the development of the training for secondary transition. We will then train professional learning leads in each of the AEAs and provide all of the materials that they need to do the training with their districts within their AEA. So that training for the professional learning leads will begin in March. I'm going to share just a little snippet. I don't have a visual, but just an overview. Amy and Jess and some folks from the field have worked really closely with me and really taken the lead on a lot of this work for our post-secondary summary. So as a part of secondary transition, IEPs, each student is required, each IEP is required to develop a post-secondary summary for each student. So it's not required that there be a family meeting. It's not required that partners be involved, but it's highly encouraged and suggested. So what I found as we were developing the materials for the post-secondary summary is that it isn't happening very often that our partners in the adult services arena are involved with that post-secondary summary meeting. As we started talking with practitioners in the field, oftentimes it's a student and a teacher sitting down together and filling it out, and families aren't involved. They're not required to be, so that's not a legal issue, but foundationally, we felt like that was kind of a challenge, that ideally you would have everybody involved. So anyway, we have created a system that for this part of the IEP that we're hoping is a lot more interactive, a lot more supportive of the transition to post-secondary and inclusive of the student and family in the process. So within the post-secondary summary, the IEP team will talk about the students' skills and their goal areas that they've had over the last 3 years, and talk about their current level of functioning and their needs related to their post-secondary expectations in living, learning, and working. But then there's also a section about linkages and connections that's focused just on linkages and connections. This section will be open as soon as transition planning starts, not at the time of exit, which is when post-secondary summary is normally begun. But it will be available so that people can really use the tools and resources to begin to make those connections at age 14, 15, 16. So the overview, the post-secondary summary topics are things like long-term services and supports, centers for independent living, voc rehab services, how to connect with adult service providers, transportation, financial wellness. There's just a ton of different, there are like 12 different topics, but then a ton of resources around each of the topics. Because the other thing we learned in the development of this new system is that in our small school districts, especially, teachers are, oh, thank you, Amy. There's the list of all of the resources on the newly developed Iowa Secondary Transition Learning Community webpage. So oftentimes teachers in smaller school districts will only occasionally have a student that needs referrals to long-term services and supports, and they don't know how to support families through this process. So we have created a one-stop shop for all things linkages and transition so that folks can work through all of those complicated steps. So this was a challenge because with our regions and the different steps and processes in each phase of the referral process for long-term services and supports, for example, it might look a little different in one county from another. So we had to try to make it a statewide resource. There are snippets that Jess created that walk through every step of the process and how to access the services. It's really a ton of information. We're really excited about it and really excited for people to start using it and provide feedback and
Amy, you have a phone call on line one. Amy, line one. Thank you.
So anyway, looking forward to all of you using that and letting us know what you think. And then the last topic is the IDEA-DA. So the Individuals with Disabilities Education Act has 17 indicators. 4 of them are related to transition. 1, 2, 13, and 14. 1 and 2 are graduation and dropout rate. 13 is how well we develop our IEPs, and so that they're comprehensive and clear, and that they provide a path to the post-secondary expectations. And then 14 are our outcomes. Our students working and or learning beyond high school 1 year out. So historically, that data has really been at the state level, and we're now moving it to local level so that individual districts will have information on how their students are doing in all of these different areas. And then we have targets for districts and for the state. And if you are not meeting targets, you're in one of 3 levels. Universal means you're meeting the targets and you have access to all of the learning services and supports that are out there universally. The middle level is a supplemental level where you have some extra resources and tools and supports at your ready. And then intensive are for those districts that are kind of at the highest need level, and they will have some additional kind of compliance or accountability actions that are required of them to meet or to move toward the targets. So through our differentiated accountability process, the next review will be the desk audit that happens during the next school year. And with that desk audit, then determinations will be made. It's not just around secondary transition as it was during the last desk audit. It will be connected more toward reading levels, so progress in reading for students with IEPs. It'll be secondary transition, it'll be identification, and then it will expand each time we have a desk audit to be a little bit more inclusive of the entire IEP process. So that's just a little rundown of what we've been up to. Are there any questions about any of the information I shared?
Bill's got his hand raised. Bill, you want to go ahead and just unmute and ask away?
I will. Thank you, Kirsten. You always explain things in such an amazing way, and I'm excited about it. But and maybe I heard wrong, but in terms of the secondary transition, it was like, and I don't know how else to say it other than it doesn't sound like there's a lot of teeth to it. Is there? I mean, it's kind of like some districts do a great job, some districts don't, and some still go through the motions. Are we taking steps to prevent some of that? Does that make sense?
Yes. So thanks for your compliment, but I didn't explain it very well if that's what you got from it. So, so the differentiated accountability. So there are targets for each of those. So I'm going to talk just about secondary transition, dropout rate, graduation rate, our indicator 13, which is how well written our IEPs are, and then indicator 14, our outcomes, what are kids doing 1 year out of high school. If districts fall in that intensive level, there are teeth to it, because that intensive level means they're more discrepant from the targets than the rest of the state. So those more intensive districts will have a process where they have to dig into the data and try to identify where are the gaps, where are the problems, what are the reasons for our lack of progress in this area, and what are we going to do about it? So what are the actions we're going to take? There will be monitoring that goes with, staff from the AEA involved with supporting and monitoring and guiding them through that discovery of the gaps and identification of an action plan. Does that help?
Yeah, it does. It does a little bit, but I guess and I like the follow-up, because I think some do good and some do don't, because I don't want to say everybody does horrible, because they don't, because there are some districts that are really pursuing it. I guess I'm a little troubled maybe, and it's probably built into IDEA maybe. Why do we not have a required meeting with families and in terms of planning? And it just seems like it's like back to that without us again. And I'm a believer in nothing about us without us. So I don't know.
I know, and you're right. It is within IDEA. It's not a state level kind of thing. It's within IDEA. We will train that's what we should do. We will encourage people, but it is not a required component. And I completely agree with you. I think it should be.
Can I add something, Kirsten?
Sure.
Bill, you might be referencing some of the earlier stuff that Kirsten was talking about, which is the post-secondary summary process that districts get to decide kind of how they work with families and students and partners in that process. But, and you might have said this, Kirsten, but in my more sort of simple brain of not understanding always the details of this, one of the things I get really excited about is differentiated accountability is actually going to give more teeth to implementation and outcomes of IDEA than anything we've had before, because there is those requirements of the different indicators. And before, if a district didn't do well on indicators like 13 and 14, for example, which have to do with the IEP and then the 1 year out of school, which is really kind of where that post-secondary planning kind of comes in for students and how they've reached those goals. You know, it does give a little bit more teeth to assessing how districts are doing and trying to identify supports for district. Is that fair, Kirsten?
Yeah, no, that's absolutely right. You said that really well.
Thank you. Thank you. And I love y'all are able to get into my brain and figure out what I'm actually trying to say, because I really am. And it tends to come out with me as criticism, but it's like trying to figure out, okay, what does this mean? Because I love, you know, the accountability piece and stuff. And thank you for explaining it. I figured it was probably an idea thing, but gosh, we got to get to a point where we got everybody at the table.
Well, what we're really hoping with that post-secondary summary form, so in the past, and really in the present right now, when a student exits, there's a button that you click that the student's graduating or exiting school for whatever reason. And then that post-secondary summary form comes up and you've been through that and you review, you know, the students' current levels, how they're functioning in living, learning, and working, and et cetera. But it just comes up right there at the very end. We, in this new system going forward now, starting in April, that form will be available as soon as the student enters the transition planning part of their IEP. So no later than age 14, earlier if the IEP team determines that they want to start it earlier. But when they can start using that form, start using those resources, start doing that planning, we're hoping that that makes a more involved, makes that process more integrated into the whole IEP process, and it will become a more interactive and inclusive and dynamic kind of process rather than a form that has to be filled out at the end.
I had a question. Are the tools that they used to have kind of a packet for guardianship and kind of the decision-making process to help educate families, is that kind of built into this system as well? I'm sorry if you commented on that, and I was just curious.
No, I did not comment on that, Kyra. And so when you say they used to have, I'm guessing that several years ago, there was a state announcement, kind of some papers, documentation that we used that guided people through the age of majority and the transfer of rights. There are also a number of different packets, and some AEAs might have created something unique to that AEA around supported decision-making and guardianship kinds of issues. So I don't know exactly what things you're referring to, but in that list of resources that we have created, there is one topic specific to supported decision-making and guardianship, where there are numerous resources that families and educators and all partners in the IEP process can use to make decisions about supported decision-making and what level of supports that student might need. Does that answer your question?
Yeah, I just knew it's part of that process and helping to educate families. And I didn't know if those types of tools would be provided inside of this system. I just wasn't sure if that was going to be part of that, because I know sometimes teachers struggle to help educate families or answer questions. Right. So I didn't know if there would be some kind of tools or things in there to help teachers or, you know, families.
So not technically inside the Achieve IEP system, But on the Iowa Secondary Transition Learning Community, or the ISTLC, there is a document that has links to numerous resources around decision-making supports.
Sure.
And that will be available to all secondary teachers, families. I mean, it's available right now on the ISTLC site.
Thank you.
You're welcome. And actually, I have to say, if you talk to people about the ISTLC site, this is brand new. So the site is not brand new. It's got a new look, but the resources being posted on the site has happened within the last week. It's brand new. So there are not very many people that know about it. You guys are really the first public reveal. So special group here.
I feel so special.
Yes.
Well, and as folks start to check those things out, because you really are the first group to kind of know, to have us very publicly kind of share these resources that are getting put out there. If you have comments or feedback on if there's any part of it that's confusing, or there's gaps, or if there's additional things that you think need to be put in there, please just reach out and let us know, because it is early in the process and it would be really helpful to get feedback from all perspectives about it.
Absolutely.
I can let the State Office of Public Guardian know as well that that's out there, so she can check it out as well. So I'll push that forward too.
Thank you. Any other questions for Kirsten? Kirsten, thank you so much for the update.
You're welcome. Glad to do it.
Very, very busy and a lot of really exciting things, I think. And even when we talk about education, you know, for some of you, you might go, well, maybe I'm not working with you, so what does that have to do with me? But there's so much interconnectedness between how we should be working together. Bill gave a perfect example earlier of we really all need to kind of collectively work together, both with our youth and in that transition and our adults. And it makes such a difference in planning if you have partners at the table and you have the right resources in front of folks. So a lot of the resources that were developed that Kirsten referenced could be really beneficial to adult service providers as well. And there, you know, there's just there's value in this, and hopefully we'll just continue to refine. So thank you very, very much. Lynn, I was going to have you go next, but we're at 10:30, so I'm going to ask if Leanne Moskowitz is on yet. She had a very narrow window of time, and I'm afraid she gets pulled in so many different directions that we want to adapt if we can get her to come and talk about Medicaid stuff. So Leanne, are you on yet? No, Jess is saying not yet. Okay. So I keep putting this in the chat, and I apologize to folks, but I know that sometimes as people join us later, they may not get this information. So I'm just going to remind folks, meeting materials, I'm going to go ahead and put that link in the chat again. Can be found at that Google Drive, that share folder. Leanne actually sent this morning a document, and I can bring it up here. I'm also putting in the Jamboard link.
And Amy, I do see that she's on, but I think she might be unavailable. So just FYI.
Okay. So Leanne's going to jump on here in a second. I'm going to go ahead and take the screen again. I've got to get out of. I'm going to actually stop sharing my screen until I can figure out how to do this better. Maybe everybody take just a few seconds to think about what they're thankful for. Since I can't make people, do introductions. Okay, I'm gonna try this again. All right, so in that folder, this is the resource that that Leanne shared this morning to ask us to share with everybody. And we'll again include that in the notes if you're not able to access the Google Share Drive. If you need it sooner than when we're able to get the notes typed up and sent out, just let us know and we'll send it to you. So that this is in that folder, and I just wanted to point it out to folks. Leanne, are you available now?
Good morning.
Good morning.
How's everybody doing today? Apologize for joining late. We're kind of double booked, and I needed to listen to the presentation on the Hhs realignment. So I'll dig in and talk to you all a little bit about that. And I've provided links to the information that I'm going to share with you all. I'm going to try and be brief. I know we've got kind of a condensed time frame here. So if I go through this kind of fast, just be assured that the information is on the document that Amy was just showing. So I'll just get started here. For CMS flexibilities, we have resumed the pre-COVID Medicaid eligibility processes. And so folks who were continued under Medicaid eligibility during the public health emergency continue to receive Medicaid coverage throughout the duration of the public health emergency. However, people who were previously continued on like a LTSS service, Hcbs waiver, state plan habilitation, those folks have been transitioned to other Medicaid coverage groups when they're eligible. If they're not eligible for another Medicaid eligibility group, they'll stay in the group they're in until the end of the PHE, and then they'll get notice of their eligibility status at the end of the PHE. And of course, part of the public health emergency maintenance of effort requirements is that we conduct a full Medicaid redetermination post PHE before terminating folks. So folks that will be terminated from Medicaid will be terminated because they no longer meet the eligibility requirements at the time the redetermination is done. So just FYI for that. Couple of informational letters links are included in the update for that. The American Rescue Plan Act, I'm sure you all have heard about that. This is the American Rescue Plan Act provides for an additional 10% federal match on state Medicaid dollars for specific Hcbs service lines that are reported to CMS on our quarterly CMS 64 report of Medicaid expenditures. And so for the period starting April 1st, 2021 and ending March 31st of 2022, the state is drawing down an additional 10% FMAP on specific service lines for Hcbs services. And that's not just waivers, it also includes like rehabilitative services, prevention type services like EPSDT, state plan, Hcbs, home health services, those kinds of services that are typically considered under the big umbrella of Hcbs. And so we submitted our first quarter update to CMS on 10/12 of 2021. We have received preliminary approval, but the preliminary approval does not authorize us to begin spending the funds. They had additional questions on some of the projects we had identified in the preliminary spending plan and narrative. We had to respond to those questions and address those in our first quarterly update to them. And we are waiting on the conditional approval. When we receive conditional approval, that means that we can start spending the funds for all of our projects. And so we're waiting on that, and we hope to have it here soon, but we'll see. Some of the key things that we've been focusing on right now is the RFP for the Behavioral Health, Aging and Disability Service System Evaluation went out, and the anticipated begin date for a contractor, for the selected contractor, is December 1st. So it should be coming out any day here, who's been selected to complete that evaluation study. Our intent is to also then to contract with that same vendor, perhaps to go through the implementation plan with us on that thing, on the real, scan and make recommendations on improvements, things like that. Things that we've heard from folks is having the same menu of services available to all Hcbs waiver members, so that members can access what they need when they need it, and it's not contingent on a specific set of menu of services that are available for them under the particular waiver. So getting more alignment and more equal access to services, making meals available for everybody, perhaps making transportation available to everybody who doesn't have access now, adding employment services under the other waivers that don't currently cover employment services. Perhaps residential gets added to the other programs. So it'll be things like that, but and it's not just going to impact our Hcbs waivers. It's going to be a whole system-wide scan. And so we're going to be looking at, what do the regions cover? What are they responsible for? What do they pay for? How does that interact with what Medicaid covers and pays for? And now we've got, IDPH with the Health and Human Service Alignment. What do we pay for in common? How do we best serve Iowans? And so I think it'll be kind of an extension or in cooperation with the recommendations that come out of the Hhs alignment work also. So a lot to come on that. And I put the link for the RFP in there if you're interested to really see what the scope of work is and what we've asked them to do. We are going to be holding stakeholder listening sessions for one of the pilot projects. We have a pilot project identified in the ARPA spending plan and narrative. It's a community-based neurobehavioral rehabilitation services residential service for children. Currently, we only provide residential services to adults, and we would like to develop an RFP for a provider to come in and develop a service model specific to meeting the neurobehavioral needs of children who perhaps are currently going out of state, going into a psychiatric medical institution, sitting for long periods of time in ERs or in hospitals, shelters, et cetera. And so we really want to, the overall goal of the pilot project will be to develop a service model that can be replicated to serve Iowan children, keep those children in Iowa for their neurobehavioral care. So we will be holding 2 listening sessions on December 8th. Those will follow kind of the same format that we've utilized for the town halls. So from 4 p.m. to 5 p.m., we'll solicit input from providers and other provider advocacy organizations, et cetera. And then from 5 to 6, we'll solicit input from members, brain injury survivors, their families, advocacy organizations, and others, interested stakeholders, into what should be the expectations around that pilot program, the outcomes, considerations when developing the scope of work. Perhaps it's what would we expect staff training to look like, or a specific skill set. What types of services and supports would we expect to be delivered? Those, what kind of community connections would we expect? Those types of things in order to help us really help inform what that RFP will look like for the pilot project. So, and we're doing this because we want all stakeholders who are interested to be able to have equal opportunity to provide input, and for providers to have the opportunity to provide input and not be excluded from the bidding process, right? We got to be careful with that. So we want everybody who's interested to be eligible to submit a project proposal when it comes time to do that. And so we're super excited about looking at, again, expanding brain injury services. Another thing that we've been prioritizing is the recruitment and retention grants. We have heard from providers out there, we are in a direct care workforce crisis, and that providers are struggling just to meet the basic health and safety needs of the people that they're currently serving, having little to no ability to take on new members, having to consolidate services. We know there's also a lot of providers out there who are closing service lines and reassigning staff to other program areas because of the extreme staffing shortage. And so, the recruitment and retention grants are intended to give a one-time funds or give funds to provider organizations and other direct care worker folks for the purposes of recruitment and retention to try and help stop the bleed. So we are currently working on what those application process is going to look like, identifying the target population of direct care workers. We know there's not enough money to support all workers in all areas. We've really been looking at those Hcbs services that are, supporting people on a daily basis type of thing. And really, what's really hard about this is that, there's only so much money, right? And we know everybody has a need. And so having to try and prioritize where those funds get directed is it's tough. But so we will be working on that process. Our goal is to push out the first quarter funds, hopefully during the month of January. And so stay tuned, more information will be coming out on that. We imagine that the application process will look very similar to the process that providers have used to request the CARES Act funding, an online application, and provide a little bit of information and attest to how you're going to use the funds, and then we'll make direct payments. So it should work very similar to that. It may work differently for other direct care worker types such as CDAC and CCO. The process will be a bit different for them since they're not tied to organizations, but more to come on that in the future shortly. We're also really looking at the HIT and the remote monitoring grants, the health information technology remote monitoring. We really believe that providers will want to leverage a combination of both of these funds in order to look at engaging a technology-enabled service model and what that might look like. And so we are going to be soliciting additional information on how folks think those HIT and remote monitoring grants can be used. We did the workforce shortage work group, heard from LAD Inc. out in Ohio, who has been operating a pilot, I think, for a little over a year of serving individuals with an intellectual disability diagnosis in a home in the community under Hcbs that's fully technology enabled. And so they've seen some really good things with that, had a good experience, and are working on a toolkit to replicate that can be pushed out to other organizations that really has provided the map of how you change or metamorphosize your service model into a technology enabled service model. And so it's one way to try and address the workforce shortage. What the technology enabled model help folks do is put the technology where it can be used, and you know, this is not for every member. You know, we know that there are people that are being served that need that person there with them. So there'll need to be some kind of assessment on whether or not a person can be, you know, have their needs safely met in a technology enabled service model. You know, and then what that enables providers to do is put the staff that they do have where they're needed, and not have somebody, you know, there 24/7 when they're not needed. So, you know, there's also opportunities to look at how we use this in other services, employment services. You know, we had the pilot project that the USED did using tablets and job coaches. And so I could certainly see an agency saying, hey, we think we can really support more people if we start using more technology. And you know, are there things that we need to
We're
do?
ready to go. I'm probably just going to go to the bathroom now.
Oh, whoops. Thanks for sharing, Kristen. No. But anyway, so with the remote technology, we're going to be hearing more about that. There's also Good Life Innovations in Kansas, who works with the University of I think is it Kansas State or University of Kansas, one of the two, one of the universities in Kansas, and has been delivering remote or technology enabled services for quite a while, and have really good evidence to support that the model can work, and also have kind of a model map of how this can be done. And so we're going to be getting more information from both of those entities. And I know we've already had some providers go out to Ohio and actually see how this works in these gentlemen's day-to-day lives. So it's could be a potential solution to help address some of the problem, not all of the problem. And so we're also going to be, you know, we want to prioritize those projects that can push funds out to providers. You know, can we purchase a service documentation platform software that's going to, you know, help streamline your service documentation, help remove some administrative burden on your direct line staff, your supervisory staff, your quality management staff, things like that. So we really want folks to be thinking about how they can use these funds and be prepared within your organizations to submit an application for the funds when we make the announcement that those funds are available to be released. Hhs Alignment. So I want to make sure you're all aware of what's going on there. There has been a preliminary change package published. It's high level, so if you're expecting granular detail about who's going to be under what, you know, division administrator or bureau chief, or they're not there yet, but it's high level. These are the connection points of the Hhs alignment. These are the things that the change teams, that, you know, the input that has come in so far to the department on areas of alignment. It's important that people know that the ultimate goal of the Hhs alignment is to better serve Iowans. You know, we've really talked for a long time about having the no wrong door, right? But depending on which, you know, publicly funded benefit a member wants to access, they could potentially, you know, communicate with 3 or 4 different, you know, connection points within our state organizations. And so the goal is to really make it no wrong door. So when you call into a central line, you get connected, streamlining the application process. If you're applying for one publicly funded benefit, that application counts for all the, you know, publicly funded benefits that come through the Hhs departments. So the public comment period is open now. We really encourage folks to go in, and the listening sessions for the public are occurring, I believe, next week. I included the slides or the PowerPoint that they'll review during, or for the preliminary change package. And if you go to slide 9, that has the schedules and of those public input periods. It goes through December 3rd. So, you know, we don't want it to get lost during the holidays, and we need everybody's input. It's so important because this is a monumental change. It's huge, and it's really going to change the experience of Iowans when it comes to interacting with, you know, health and human services. So I did put the link for the Hhs Alignment webpage, and on that webpage you will find the preliminary change package. You'll find the connection points report, and it might be helpful before you read that. It might be helpful before you read that preliminary change report to go in and read that connections point report. It kind of, when I tried to read the preliminary change report first, I was like, stuff's missing, right? And then when I went back and I read the connection point first, I was like, oh, okay, now it puts it more into context. It makes more sense. And so I really, you know, recommend that. Unfortunately, we asked this morning, there isn't any other alternative other than to participate in the online public comment periods right now and submit online. There's not like a paper way to, you know, submit comments. So if you know someone who maybe isn't technology enabled, maybe you could connect with them and you know, submit comments on their behalf. But we really want as much input as we can into this. So it's that connections point is a lot to read, let me tell you. But it really helps put what they're putting into the preliminary change report into context. But again, remember, it's very high level. It's not getting into the granular detail of what's specifically going to happen yet. Legislative reports. So legislative reports are out there, you know, specifically to Hcbs. There's the annual elderly waiver expenditure report that we do in response to removing the cap on the elderly waiver. There's also the brain injury waiver expense report that we do in response to removing the BI waiver cap. And so those are out there on that link. Legislative session begins January 10th. I've included the link to the legislative session timetable so everyone can be aware of that. Excuse me, policy changes, individual placement and support. I don't know if Lynn is on real quick. I don't want to put you on the spot, Lynn, but you want to give a quick rundown on the Aspire project. So this is implementing individual placement and supported employment under the Hcbs habilitation program for persons with chronic mental illness or serious and persistent mental illness. And we are a Aspire grant recipient. Lynn, you want to talk about real quick, or maybe you already have before I joined?
Yeah, I think Amy's got me slated for a little bit later on here.
Okay,
So
well,
I'll do that as part of my update. Yep, thanks.
Gotcha. We'll skip that. Anyway, so then the Hcbs eligibility and home-based habilitation criteria. If you recall, we were changing the risk-based criteria, needs-based eligibility criteria, implementing the locus cal locus acuity score in order to authorize home-based habilitation tiers. We are working with CMS on that state plan amendment. A wrinkle that came in that we didn't anticipate when we went down this path and created all these changes was that the American Rescue Plan Act maintenance of effort requires states to not implement any policies or procedures that would be more restrictive than what was in place on April 1st, 2021 through the end until the funds are fully expended. For us, we believe that's going to be March 31st, 2024. So we are debating and negotiating with CMS. You know, the work group put these changes into place to actually expand who we could capture and be as being eligible under habilitation, as well as provide a fair and equitable way to authorize services going forward. And we are in a predictable way for providers, right? If my locus score doesn't change, I stay at the tier that I'm at unless I say I don't want this much service. But CMS sees, because we're changing some of the language and the eligibility and the needs-based criteria there, and we're adding the locus acuity score for HAB authorization, they're viewing that as more restrictive. And so we're still discussing and negotiating, but in the meantime, we've postponed implementation until April 1st. Now that may change again, depending on how things shake out with the SPA with CMS. But you know, the MOE related to ARPA has really hamstringed states' abilities to make changes to their waivers unless they're, you know, increasing or expanding. So it's something we got to work through. Let's see what else. Hcbs. So the Hcbs providers now have access to Hcbs waiver and habilitation eligibility information in the Iowa Medicaid Provider Access Portal. Providers had asked for this for quite some time during the provider process improvement work groups and conversations, and it went live on October 22nd. So now providers will be able to go in, put the member state ID into IMPA, and be able to see whether the member is eligible for Hcbs waiver or habilitation services. So great news for providers. You know, hopefully this is a temporary stopgap while we try to modernize our eligibility systems that providers access. So 5-year rule review. So all state agencies are required to complete a fulsome review of their administrative rules every 5 years. The 5th year has rolled around. We have to complete a review of all the Medicaid chapters by April 2022. And so we will be going through each rule section, paragraph by paragraph, to identify any technical changes, any outdated language, anything where we're not in alignment with the federal rules. Maybe we changed a form somewhere down the line and we didn't change the form number and rule, or, you know, some process has changed, some policy has changed, and, you know, other changes that may be needed. And so we are going to be working on that this winter, identifying that areas that we think need to be changed, but we're also going to be soliciting input from the public, because we know that there may be things that we have in rules that, you know, from a policy perspective make a lot of sense, but maybe from an operational standpoint, it doesn't. And so, you know, we certainly want to go back and, you know, reconsider those things. You know, from a departmental standpoint, we're looking at our family caregiver policies. In the light of the workforce shortage, we recognize that we really need to take a hard look at those policies that maybe prohibit direct family caregiver being reimbursed or maybe having access to respite. And we know that we're going to become more and more heavily reliant on family caregivers in the future. And so we really want to get our policies in a line and so that they are supporting these family caregivers and removing any unnecessary barriers to access for services for the folks that are receiving care. So we will be getting public input. I'm not sure what that process is going to look like, probably a town hall, perhaps some public forum type of methods. My goal, being the lead on this project, will be to try and spur all the subject matter experts to get their areas reviewed, provide some high-level summary of what they expect needs to change, and then be able to push something out to the public to react and respond to, because it's always easier, you know, when somebody puts something in front of you to give comment and feedback than it is just to say, what rules need to change, you know, because there's so many. But if people have specific ideas right now in their head that, hey, this causes me a problem, or this is a barrier for somebody that needs to change, email me, and I'll take all those comments now too. So please do. Policy wants to get on this, and we want input from everyone. Next, so we do have a couple of rules packages that are in flight. So the Hcbs cost report rules. We met with providers who complete cost reports and amended the cost report rules to bring more clarity, improvement, include additional service lines or cost lines as allowable, especially around like IT, staff hours, trainings, et cetera. And so it was a stakeholder effort. Those rules have been sent over to the AG's office. And so now we start the back and forth with the AG and then fiscal. And then of course, we'll go through the normal rules process of being published in the public administrative rules bulletin, and then soliciting public comment. So we also have the health home rules. Those are in process. Again, we're targeting July 1st for a start date. What those rules are implementing the state plan amendment that CMS approved last year. So working our way through that. Our elderly waiver and our children's mental health waiver, Hcbs performance measure evidence is due to CMS at the end of December. And so states are required, it's usually about 1.5 years before the waiver expires that CMS asks for evidence. And then based on that evidence, CMS asks the state to make corrective actions if needed. And then those corrective actions are then implemented into the waiver's renewal package. And so both the elderly waiver and children's mental health waiver, those expire in 2022. And so we'll be working with CMS on that evidence package next year. And then 6 months before the expiration of those waiver applications, we'll submit the renewal package to CMS, and we'll solicit feedback for that. And so you can see the health and disability waiver, we submitted evidence to CMS last year, worked with them this year through the comment process on where we needed to do some improvements on our remediation. They have recommendations for us, and we kind of have a back and forth. And our actual renewal applications are due to CMS 6 months before the waiver expires, and so they're due to CMS on May 1st. And so the program managers for those waivers will have a public input process. Of course, our waiver amendments will go out for public comment as well before we actually submit them to CMS. So I would look for us to probably put those out for public comment, I would guess maybe in late March. And so we need to get on it. A lot of work going on the policy team. But good news is we do have 2 new policy staff folks that are going to give Brian and I some relief, much needed relief. We have Jason Watson, and he joined our team just about 6 months ago, maybe it's not been that long. But he is going to be taking over the AIDS, HIV, the physical disability waiver, and the health and disability waiver from Brian. And he's going to be taking over transportation policy from me. And so when I talk about transportation policy, that includes Hcbs waiver, ambulance, ground emergency medical transportation, supplemental payment program, and then of course our non-emergency medical transportation. And so we'll be working with Jason, Brian and I both will be working with him over, probably the next 6 to 9 months to transition those things. And as they learn, and get more confident, we'll back out and they'll come more to the front on dealing with things. So, and then we have Tracy Else, and Tracy Else is going to be taking over the elderly waiver from me. And he is also going to be taking over case management, employee visit verification, and money follows the person from Brian. And again, those are big programs, very complex. And so, we'll work in tandem together, again, probably over the next 6 to 9 months to transition. And as they become more comfortable with the information and with the policy and procedures, again, we'll back out and they'll come to the front until we're, transitioned off. But we continue, we're all one unit, our little mighty Hcbs team, and we all support each other. And so, we're still there supporting them, even though if we aren't attending the meeting. So just so you know. Stakeholder work groups, we've had a couple of stakeholder work groups going on. The Iowa Medicaid Workforce Shortage Work Group, we've really been trying to focus on innovative solutions to the workforce shortage. We've been talking about technology-enabled services. We've been talking about the use of ARPA Hcbs funding to address some of the workforce issues. How can we perhaps use those funds for some of the grants to shift resources within our organizations over to workforce, right? If you have a grant to support your HIT or your costs related to remote monitoring, those kinds of things, and perhaps you can shift those funds over to focus on employee recruitment retention efforts. So they're just talking a lot about what can we do. We heard some really good information also about, apprenticeship programs. Looking forward to hearing more about that in the future. Providers learned that one provider had exceptional success using Facebook Marketplace for recruiting and was able to fill her open positions. And before, it was crickets. Didn't have any applications, and then once moved and started using Facebook Marketplace to actually target the demographic she was trying to reach with her open position, she was able to fill those. And so it's been really good space to share information and talk about solutions that are working and stuff that hasn't worked, right? Everybody has a different experience. So there's also an Hcbs Consumer Choices option work group that has convened. And so these are members that have chosen to self-direct their services, that have a monthly budget that they manage in order to hire employees to meet their service needs or to purchase goods or other services in order to meet their service needs. And, there's every program has room for improvement. This group is coming together to talk about their experiences, talk about their challenges in accessing services and supports, and some of the policies around the CCO program to try and come up with recommendations for policy and process improvement. And so I think they've met twice now, and will continue and develop some solutions for that program. Let's see here. Oh, part of that's also the reviewing that utilization factor for CCO. We know that's a real pain point for folks and can sometimes be a barrier to paying people appropriately. Also looking at the integrated health home process improvement. So we'll be having work groups. We're having a couple of listening sessions to gain input. And then we'll have some smaller work groups where we're going to dive in and start looking at process improvement, as well as the reimbursement methodology for the health home services, and ensuring that we're looking at appropriate staffing ratios, staffing models, those types of things in development. We'll be looking at other states to see what they do with their health home state plans. So then I provide you a bunch links to the informational letters that have come out in the last couple of months, about Hcbs. So there's an IL addressing the habilitation program changes, the IL about the grant. So the timeline, providers have until tomorrow to submit their application for their portion of the CARES Act grants that the governor set aside another $6.4 million for CDAC, SCL, and home-based HAB providers. And so, again, I think it's really important to hear from folks about the importance of including employment services within the considerations for these ARPA projects and grants and things like that. Again, we know we have a shortage of employment supports and services out there also. Let's see here. Talked about IMPA already. The rate changes. So there was some issues around the rate changes for CCO. And so we sent out a follow-up informational letter about how those rate changes are going to be occurring for CCO members in their budgets. Town halls, if you haven't participated in the Medicaid town halls, I really encourage you to do that. It's good information. It's a great opportunity to have direct interaction with the Medicaid director and also policy staff, others, not just policy staff, other staff within DHS, get your direct questions answered, and also hear from other stakeholders on what their thoughts are and how things are working or not working. And so we've gotten really good feedback. We've identified, again, some pain points, areas for improvement. And, our goal is to keep making those connections and keep trying to improve. I believe that Director Mantney intends to, do this monthly from now on. And so I encourage you to do it. It's every month. And I want to say it's like the second or third Wednesday of the month. So if you go out on that link, it'll take you to that information. Community integration town halls as well. We have a community integration project going on. And so I encourage you to participate in those. Again, we need to hear from a lot of voices on what's working, what's not working, and where you recommend changes or improvements. Let's see what, yep, go ahead.
I'm sorry, can I interrupt you for a sec? One I wanted to ask is if you could send us the name of the new policy staff, email that to us. We'll include it in our notes for folks, and their contact information, just so folks have it.
Oh yeah, sure.
Bill has his hand up, so if it's all right with you, could we go ahead and have Bill ask for a comment?
Yep.
Thank you.
Thank you, and thank you, Leanne. And of course, I always have to have something to say, but I ain't gonna lie, Medicaid policy still makes my head hurt sometimes. But I want to reiterate what you talked about with the town halls, and for me as a family member, that's really heading in the right direction. And you've said that to encourage folks to participate. I want to reiterate that and support that. I have a couple, actually one was last night and I was traveling, so I couldn't participate. But I've also had a couple pretty productive conversations with Liz Matney. I'm going to just say at this point, we're moving in a better direction. So I guess we'll wait and see what happens, but I'm starting to feel like we're truly being listened to. And a lot of the things that you comment on came from some of the consumers and families. And I'm glad to see, and I talk about teeth a lot, and I feel like we're actually looking at maybe putting some teeth into some of this stuff and recognizing. So thank you for that. But again, stay tuned. But so that's positive today, Leanne, don't you? But I want to encourage y'all too, and also not only as providers, but also encourage the families and consumers that you work with to jump onto those town halls, or send an email to Leanne or Liz Matney, because she has responded, and I've appreciated that. And I said we've had a couple really good conversations, and I look forward to working on some of the work groups. So thanks, Leanne.
Absolutely, and Liz has an open door policy, right? An open communication policy. And so she has no problem with people emailing her directly. She will respond, and she will connect you with the person who can help you. If there's a specific problem that needs to be, solutioned. So I think,
and that's what has encouraged me. And sometimes it does take a while, and I understand she's busy, but she has called me a couple times, and we've had some really, really fruitful conversations. And she knows that I'm upfront, and as you do, Leanne, sometimes it's, and Amy gets to kind of figure out what I'm trying to say, and she does a great job with that. So thank you all.
It's clear to me, Bill.
Our brains are connected somewhere, I think. So.
Somebody asked in the chat if there's a link for the town hall. It looks like somebody provided that, but it also, if you go to the IL 2261 link that I put in the document today, that'll take you straight to there, and you can, you know, register and get the calendar information and connection. You can connect via Zoom or by phone if you know, don't have an internet connection. So yeah.
Excellent.
Is there someone on the CCO group from IVRS? Not at this time. It's really consisting of members who are self-directing and their families and their caregivers. But I can certainly, you know, ask Brian. You know, I think all input is important. But we really wanted to focus on those folks who are self-directing and their family and caregivers. And sometimes it can be a barrier when we have a lot of state staff to enable that free flow of conversation. But I'll take that back to Brian and talk about maybe opportunities to engage some other folks who are interested in those CCO conversations. Let's see here.
Leanne, is there, I know that you're pressed for time. We also have Daniel, who is jumped on about 11 for an introduction. So is there anything that's really pressing that you still have, or?
No,
Nope.
that's I kind of gave you the high level today and threw a lot out there. But if folks have questions or comments, or they need some information, you know, feel free to email me or, you know, email Jess and Amy, and they can get that to me, whichever you'd like. And if I'm not the one, I will send you in the direction of who can help you.
Thank you.
Yeah,
and
absolutely.
you gave so much good information, and we'll try to include in the notes some of those pieces that people asked about. It's in the document as well that Leanne shared in our share folder, which we'll also email out to folks who aren't able to access that. So thank you, Leanne. I'm going to go ahead and turn this over to Susie, and I'm just delighted to have Daniel here and Susie here, and I'm going to have you go ahead and kick us off, Susie.
Thank you, Amy. It's really great to be here. And I just wanted to introduce to you our new administrator. His name is Daniel Talon, but I'm going to let him tell you all about himself.
Thanks, Susie. Yeah, my name's Dan Talon, and I've been here for just about 3 weeks. I'm very excited to be leading this organization. I'm really passionate about the work that our vocational rehabilitation counselors do on a daily basis, and about the impact that they have on the lives of their job candidates and clients from 14 through the end of their careers. So I'm really excited to be here, really excited to advance their work and the cause, and to partner with all of you. I think it's great to see so many people discussing this topic and working on this issue. And so if there's anything I can do for any of you, please reach out and let me know. And if you have any ideas or anything that we can partner on or do better, I'm definitely open to that as well. Really excited about the future of the organization, and also the future of employment for individuals with disabilities in the state.
Thank you so much, Daniel, and thanks for joining us today. One of the things I want to just throw out to offer to you as well is the coalition is comprised of a lot of diverse stakeholders from all across the state who really come to the table with varying perspectives. And the only thing we all agree on is that we'd like to see more, competitive employment outcomes for Iowans with disabilities. How we do that, sometimes we vary in what needs to happen, but that's what enriches the conversation. And so I want to share that in just the sense that this is a nice avenue for you or anyone at VR to be able to connect with people across the state, get input, share information, it's kind of whatever you need. But I think that the coalition is a really nice group of folks from all across the state with varying perspectives, and they've been incredible partners for the last 10 years. And so VR has been a great partner as well, but this is an area that if you want feedback or you want to share information, please take advantage of it, because we're kind of all here with the same goal. So I just wanted to encourage you to feel free to reach out at any time to the coalition.
Awesome. Yeah, thanks. I will probably take you up on that. I think that my vision for our organization is to serve the individuals who are enrolled in our services, but then also to serve the disability community in general too, and advance that cause. And so we're really excited for opportunities to partner to make sure that we are kind of hitting the issue from every angle that's possible. So I think everything's on the table for us for how to advance the cause. And if there's something that we can do through partnership with any of you, really excited to hear about that and to move that forward.
Thank you, and welcome to your new position. I hope you got rid of all that Iowa State stuff in Dave's old office.
There will be no Iowa State things here. Yeah.
Sorry, Brooke. I'm just kidding.
I have to say, Daniel, I think I heard that you have Dubuque roots, so I live in Dubuque.
Amy.
So.
I've met you, Bill, once at the coffee shop with your son in the Millwork district once. We were listening to somebody that came to speak. So.
Okay, great. Well, welcome aboard, and anything that Kyle and I can do to assist, we're glad to do that.
Awesome to hear.
Great, thank you so much. Susie, I don't know if you have any other VR updates right now that you might want to share, or are we good to keep moving forward?
I think we're good to go ahead and keep moving forward. Vienna wasn't able to be here because they're doing an IPS meeting. So she sends her apologies.
If Vienna has any updates that we weren't able to share today, we'll make sure to include that in the information we send out to folks. So
okay.
Thank you, Susie.
Thank you.
Lynn, I'm going to turn it over to you and have you share what's going on with IPS in Iowa.
Sure, absolutely. I do have a PowerPoint that I provided to you guys, and I think it's available in the materials. I haven't looked myself, but I'm not going to use it because I'm gonna basically skip over and just give you guys really quick, brief highlights. We have a couple big deals that have occurred recently, and I just want to let you all know. So for those who haven't heard my elevator speech before, IPS is the individual placement and support model of supported employment, and it is targeted specifically for people with serious mental illness, those constituents of ours who deal with serious or severe mental illness issues. It's an evidence-based practice. It's been very well researched, and that's stuff about that is all available to you in the PowerPoint. We're especially excited about IPS in Iowa in the case of young adults, particularly. And I just want to really briefly highlight one success story that came out of our pilot sites. A young lady, 19 years old, when she got involved with the pilot provider and the IPS program, she had experienced over 30 hospitalizations in the previous 2 years of her life. And you can imagine being 19 years old and that having been your past 2 years of history, how utterly discouraging. They got her into IPS program and found her job niche that she loved. And during the time that she was employed, she had 0 hospitalizations. And then COVID hit in 2020, and March, April, and May of 2020, she again experienced 1 hospitalization per month until her IPS team was able to get her reemployed again after she had lost her job due to COVID, as many people did. Got her reemployed. She's been stable in her mental health and her employment and her life ever since. She has experienced I believe maybe 1 brief hospitalization in that period of time, like the last year to 18 months. But she has also used a past plan to get a vehicle, and she's got improved relationships with her family. And so this is the kind of thing that employment and IPS can do for Iowans. And that's why we're so interested in investing in the IPS model in Iowa. So let's see. Aspire, you'll see on one of those slides what Aspire is. That's the name of the current federal effort that is helping us stand up some new teams. And so two of the big pieces of news right now is we chose our 3 new early adopter sites that are going to be receiving the technical assistance and training that the feds have made available to us. And the first one, Hope Haven in Burlington, had their kickoff meeting October 20th and 21st. And so they are getting their feet under them and getting rolling right now. The other 2 early adopters are Robert Young Center out of Moline, Illinois, and they'll be putting an IPS team together in Clinton and in Muscatine, and they'll be serving Cedar, Clinton, Jackson, and Muscatine counties. And then the other one is Vera French, who has partnered with another organization called Transitions, and they will be serving Scott County out of a Davenport office. And their kickoff meetings are planned for mid-December. Those are just in the planning stages right now. So that's very exciting. Our TA from Portland, Oregon will be coming and training our new first Iowa IPS trainer and fidelity reviewer who has just been hired, and it is Sherry Becker. And she will be starting on November 29th. And we're very excited because I think she'll do a fabulous job. So that's what we're looking forward to, and that's what we have going on. Anybody has other questions or want more details, my contact information is in the PowerPoint, and you can certainly reach out to me at any time. Thanks.
Thank you so much, Lynn. Sorry about the rush. We're always a little overzealous in what we think we can cover in a coalition meeting. And I'm not succinct. Maybe you've picked up on that. All right. Well, I think if folks are all right with this, we're going to go ahead and just jump in. Jess, would you mind putting the Jamboard link back in the chat box for folks? And okay. So that's excellent. I see that some folks are already in here. Some of you are probably really familiar with Jamboard, probably much more familiar with me. It's really my first time creating it and trying to utilize it. So we'll see how it goes. But what I was hoping is that we could talk a little bit and you know, our move from 5-hour coalition meetings in person to 2.5 hours during the pandemic virtually has really impacted our ability to engage in discussion as much and gather information as easily as we were when we were coming together in person. And we know this is a really pressing issue. I know that Leanne had talked about it. Many of you are in the heart of being impacted by it. And so one of the things we wanted to use some of our time in today's meeting is to actually ask for some feedback from you and some input. And Leanne had mentioned in her presentation that they're also looking at ways to try to invest, like with the ARPA funds, and support folks with being able to access some of the funding to address the challenges and to also learn about what kind of strategies might exist that have been effective, like she shared the technology. So some of the questions we have specifically came from Medicaid as well. So I have 8 pages of on the Jamboard. And if you guys don't mind, we'll just kind of start with each question. And I'm going to show you really quickly how you can use the Jamboard. Can you see my cursor there? If you haven't ever used it, on this side of the Jamboard is a number of different options of things that you can use. And I'm just going to show you with the sticky note. I grabbed a sticky note and I typed in what I wanted to say. I can move it around. I can make it smaller. I can also say, oh, nope, I don't want to say that and delete it. So did folks kind of follow? You can write too, but I don't know how anybody could write with the pen. There's also a text box. You can do that. It's whatever works for you. Since we know that not everybody is able to maybe get into Jamboard or have it work for them, and some of you maybe have also called in, as we ask some of these questions, if it works better for you, go ahead and feel free to type your response in the chat board in the chat. And then also if you're on the phone and you can't do either the chat or the Jamboard, we'll give a moment after each slide to ask for folks to feel free to unmute, and we'll capture that and include it. For some of you, you might need more time to process. I know I'm not so fast always at like thinking and typing and getting it up on a sticky note when I've had to participate in Jamboards. So we'll leave this available for people to put some additional things on as they think about it as well. And then we'll pull the information together and share it with everybody. So the first question we wanted to ask is, how have you been impacted by the workforce shortage? Oh, actually, I'm sorry. Jess, we're going to do a quick poll. Oh, nope, logged in another device. Okay, let's see if I can do it up here.
I got you, Amy. You want me to launch the rate the level of impact? Yes.
Yes, I do, please. So our
There you
first
go.
question was to just kind of gauge with the folks that are here. I will stop my screen share for a minute, right? Okay, so go ahead, Jess, and
Okay, so that,
can
yeah,
you
that
launch
poll.
the poll?
Yep, and I'm seeing some responses here, so thank you.
Oh, excellent. Okay. If I grab the screen share, because I can't see the poll because I'm a part of a host, can I put my screen share up and it won't affect your poll?
Yes, go ahead. Yep.
So Amy, I had a quick question. Looking at this from the perspective of employees, or are you looking at the impact on members due to lack of?
Thank you, Dee. That's a great question. So because of the diversity in the participants that are part of the coalition, I would like you to feel very comfortable doing it truly from your perspective. So it can be maybe, you know, it's a member perspective and that's impacted their access to services. So it could be maybe from an MCO standpoint, Dee, maybe it's, we can't find providers. We can't, you know, we're not getting people accepted. So feel free, no matter what your perspective is, to just, you know, put something in if you have something to say about this. And just, you jump in when you have some poll results, and will you just summarize those for everybody?
Absolutely. So right now it looks like we've had 35 folks respond. 2 or 6% are not seeing any impact to their organization. 11 or 31% feel somewhat impacted.
Okay.
20 of 37 or 54% are experiencing significant impact.
Okay.
3 are reporting that it's not applicable.
Okay.
So 54% significant, 30 somewhat, 8% not seen.
Excellent. Thank you.
You're welcome.
Is there anybody who isn't able to access the Jamboard or the chat box that would like to share how they've been impacted by the workforce shortage that we can capture for you? Lynn?
Yeah, I can't figure out how to make a Post-it note, but I just wanted to say, we have certainly noticed providers and the state and the USAID having trouble filling positions. Lots and lots of workforce shortage, impacts out there.
Thanks, Lynn. Other folks, feel free to just unmute if you are not able to share your thoughts either on the Jamboard in the chat box. Okay. So folks can still keep working on this. You also can go back and forth between the pages on the Jamboard yourself. So as we work through this, if you want to go to another page or you want to go back, feel free to do that. So I'm going to have Jess, you do the next poll for us, please.
All right, hopefully you see 2 questions. Asking you specifically about technology. All right, we have question number 1. Are you incorporating or experiencing an increase in the utilization of technology into service delivery? 37 respondents total. So 13 of 37 or 35% say yes, they are incorporating. 13 of 37 or 35% say somewhat. And 11 of 37 or 30% say not really. Question 2, are you or your organization considering utilizing technology to enhance service delivery? Again, 37 total respondents. Make that 38, 39. So 21 of 39 or 54% say yes, we are considering using technology to enhance service delivery. 15% say maybe. 28% say no more than we currently do. Let me end that and share. I guess I could have shared that, sorry, as I was reading.
Oh, that's all right. And we'll share that with, feel free to kind of go back if people can still do the polls. I don't know how that works, but feel free to continue to put input in there. And this is how some of this information can be valuable. Both the input that you're providing on the Jamboard or the chat or verbally sharing, and then the poll information is information that we can then use to kind of shape what makes sense next. How are people really being impacted? What are they doing? What do they need? What would help them feel comfortable? You know, for example, on the, are you considering utilizing technology? You know, maybe you need more information about what that looks like. Maybe you need some support in that. Maybe you go, how would we ever afford it? You know, that's, it's not as simple as just, you know, saying, oh, it's available now, you take advantage of it. There's lots of layers of this. So our hope is that this feedback you're providing us will help shape the information and support and resources that need to be put out there to help you get what you need. Okay, so I am gonna go, feel free to keep adding to the first page. I'm gonna go to the second page. So in this, what we want to know is what are the challenges that you might be experiencing? Maybe some of those you've already articulated on page 1, which is fine. You don't have to repost those. But if there's challenges you haven't noted already, what are those that you're experiencing related to the workforce shortage? And then what kinds of strategies or solutions or even ideas that you're wanting to try that you think might be promising that might help address the shortage? So we'll take a few minutes for folks to go ahead and put comments up here. As people are filling out and sharing their thoughts on this, I just want to make a comment that there's a lot of different entities that are trying to look at strategies and best practice and solutions with the workforce shortage. So I know that, for example, Leanne had mentioned the technology piece and the work group. Brooke, I know the DD Council has invested in some things as well, and maybe you want to share a few minutes if you want, while people are typing their thoughts up about what the council has learned from some of your investment.
Sorry, I couldn't unmute for some reason. Yeah, we did invest in some projects at the beginning of last year, and they were kind of some short pilot projects. There weren't a lot of time for the providers to complete it, so we were calling them pilot projects. But we did work for the Center for Disabilities and Development on releasing 4 grants to providers to basically come up with some type of strategy, or basically to test some type of strategy to see if that would help with their workforce challenges. 4 were awarded, and I don't know if we've got anybody on today from any of those providers that can talk about it, but the four were awarded were Hillsdale's, Trivium Life Services, LSI, and Systems Unlimited, and they all took kind of a different approach to how they wanted to address it. And it was not just recruiting, it could also help to do some retention. And so Trivium Life Services was hitting it to try and keep staff. And so they implemented the strengths-based, and I forget the name of it. Let me see if I can find it. I've got it pulled up here. It's something that we completed into the Clifton Strengths Finders, to kind of do that with all of their staff to figure out what their strengths were, how to work better with one another, figure out if they were in the right area for their organization, and if they could transition into another position that maybe fit their strengths better, how would they do that? And so they implemented that, but they didn't have a lot of feedback yet to see if that had an effect on their retention, although the staff reported that they did enjoy going through that process. Systems Unlimited did something I thought was kind of innovative, where they offered part-time or PTO for their part-time staff. And they weren't able to do this prior because of budget restraints. So that was something that they piloted to see if that would make it a case with not only getting people to come on board as part-time, but then keeping the folks that they have working as part-time. And they did get some positive feedback from that. And they can't say directly that it lowered their retention rate, but their retention rate did go down slightly from one period to the next. And I believe their board then did go ahead and voted based on that information to offer that PTO to their part-time people ongoing. Hills and Dales, is Michelle on? I thought I saw her earlier. Seen her. Hills and Dales did a variety of different things with the funds. They really hit hard their colleges in the Dubuque area and did some marketing with them to try and encourage folks to get into their field. They also established some type of, what did she say it was? It was a tracking system. It was some type of application tracking system to make the process for where people are at when they're applying for their jobs and going through the different steps that you all have to go through to get people on board, such as the background checks and all of that. I'm having different connection points so folks know where they were in that hiring process, and there was better communication with the applicants that they had, so folks just weren't dropped off. Because that process can be long. I mean, people are anxious to get employment. They'll go elsewhere if they're not getting any communication back. So that was something else they did. They did some training with their staff on basically not training, that's not workshops, I should say, on some, you hear the word training and I think people just roll their eyes, but some workshops with folks on taking better care of themselves. So they did some of that. Their hitting the colleges they thought was the most effective with that. What else? They had one other thing that they did that I thought was interesting. Let me see if I can see it. They did have some staff then that went through a different type of curriculum to be kind of in a career path. I think they had 8 folks that went through it to basically promote them into a different position. And so they used some of that funding to have them go through that curriculum so they could then give them a higher increase and give them a promoted position. So that I thought that was interesting. The last one, Lutheran Social Services also did a couple of different things. They offered offered for folks that wanted to work there a chance to get their CNA certificate and to help with some of that funding and to set up grants for that. And they said that did increase the amount of people that they that actually applied for their positions. They were still in the process of getting those folks in the door to get that. And that's something they're going to continue to do going forward, is to offer that training for folks. And then they also really did some marketing on their host homes on increasing the amount of folks that wanted to do that and use some different marketing tools. Project 7 is one that they used through social media to get that out. And they said that was pretty successful. Overall, I think they all wish they had a little bit more time and money to pilot those, but it sounded like all 4 of them were going to try and continue doing those efforts going forward. I thought it was interesting that they all kind of took a different approach on how they were going to address that, which, I mean, everybody out there is just, I think, just trying to be really creative and doing whatever they can.
Thank you, Bella. It's really nice to hear the variety of approaches people are taking and kind of what I think it's pretty impressive that even if it was a kind of a shorter term project or pilot, that many of them adopted that as practice because they saw enough, which is great,
And that's the kind of the point of it too. I mean, it wasn't going to be long going funding, but and if they, use the money and then found out, that this is not going to work, then they also know that that's not something they want to invest future funds on or future time and effort on. So.
Yeah, that's great. Thank you.
I had added it on a Post-it, but Tony Twees shared with me an interesting approach that they had taken or are using, and that's paying people on the same day that they work, utilizing a particular, I don't know if I want to call it an app or whatever, but their payment system, again, not the right word, but their system allows them, or that was like an add-on. So anyway, and they found a lot of success in paying that or in offering that, particularly to job coaches. Said that, Chime probably, that does sound familiar, Drew. I'm going to look at my notes, but I just thought it was an interesting option. And if you want to know more about it, Tony Twees was the one that had shared it with me. So.
Excellent. Thank you, Jess.
Dayforce Wallet. Thank you, Rachel. Dayforce Wallet.
I'm gonna put Kyra on the spot in just saying that I know that one of the dynamics in the discussion around the workforce shortage is who typically fills those positions and the change in demographics. And so you had women who typically filled those positions for many years, and you don't have the same growth of the demographics as far as availability for those positions. And some of the things I've read was really trying to tap into older workers, more men and more youth as some strategies. So we should probably remind folks about how they can connect with older workers who would like to explore other options. Any recommendations, Kyra, on that?
Sure. Yeah, we saw a lot of change right in the workforce, a lot of caregivers leaving the workforce. We saw a lot of people retiring early as well. So lots of changes, especially as people, were worried about COVID. So yeah, definitely you can access our website. Our IDA website has some great information about how you can get connected to our older worker employment programs, which are great options if you are looking to get connected to older workers. Our programs have caseloads of older workers who are seeking employment. So those are great options for employers if they are looking to get connected. So those are great options. But yes, it has been quite the challenge for employers. And we did see an increase in people accessing our services actually from 2020 to 2021. So we actually did see an increase in our caseloads, which is kind of an interesting observation. So we did see a 72% increase in individuals accessing our program. So we are supporting a lot of individuals seeking employment. So our program is a great option for employers right now. So a promising strategy.
Yes, we will share that information on the website for Iowa Department of Aging for folks. Thank you so much.
Yeah, and it actually has a map with the counties on it, so you can connect the employer directly to our employment specialist serving your county. So
that's wonderful. Thank you. Do we have anybody who needs to verbally share challenges or strategies or solutions that wasn't able to put it in the chat or on the board? Okay, go on. So Leanne had shared a little bit about technology, and we had our poll there. And what we really want to know is a little bit more around how people are currently sort of using, so what are you using and how are you using it, or what are you using it for potentially? And then just as important, if you're considering using something, what is it that you're considering and for what? Or if you have questions, I think even if you have questions about something you wonder if there's some technology or approaches that could help you, but you don't have any idea what that is. It's like, is there anything that would help with job coaching? You know, and Tammy Amsbaugh from the USED would say, why, yes, there is technology that could help you with job coaching. And so you may not know what's out there. So feel free to just put what your need would be. So please share what you're using, how you're using it, and then also if there's things you're considering and for what, or if you have areas you'd like addressed here.
Amy, I did list grandpads, which are a great option for older adults. I don't know if anyone has heard of them. They're kind of like an iPad for older adults. They have an enlarged icon, and they are run on data instead of on internet access. So you can pay for them month to month, and they have an enlarged icon, so you can click on them. And they are kind of easier to set up and have larger print, and can be set up for specific uses, so you can more easily access them for either social or employment or other uses, but they can be set up for the user to kind of have more specific uses, but they're really targeted towards older adults. So I did list that there. If anyone is working with an older adult, they're a really great option, especially in a rural area.
Thank you. That's great.
I saw Lynn's question. I'm not sure who, it's its own company, and we ordered them from this specific company. I can find the link for you.
Thank you. Do we have anybody who is considering or has an area of need that they want to post some feedback on? And we can go ahead and open it if folks need to share verbally their input that we can capture on this, on what they're using and how, or what they might be considering, or where they might have a need. Okay, sounds like folks are good. So feel free to keep working on that. We're going to go to the next one, which is again with technology. What are the barriers to using technology in service delivery? And how can Iowa Medicaid assist with removing barriers? So this was very specific questions that Leanne wanted asked. And I think, again, it's going to tie back into some of that strategy that Medicaid uses, and they have a lot of ARPA dollars. So, you know, anything you can share about what you see as barriers, what you need, what you think Medicaid could do to support utilization of technology, please share those thoughts. question I have for the group as folks are putting their thoughts up here is, do people think that there would need to be some real support with training and technical assistance on how best to utilize the technology? There, thanks. Somebody was typing as I was thinking that. Give this another minute or so and then we'll move on.
Amy, Iowa Department on Aging is piloting a smart home technology project with teletext technology in the city of Charles City. And it's for 13 high-risk case management individuals. And I think that might be a really a cool project to follow up with just as we continue. They just have identified the participants recently and have ordered the technology. They're doing, I'm still working on with that project and getting the information on what is within that, the independent living package that they're providing those participants. And so I'm working with that project on better understanding what they're going to be providing those 13 participants in Charles City. But I think that maybe that could be something that could provide a greater benefit to maybe also individuals with intellectual disabilities or developmental disabilities as well. That specific pilot is right now is targeted towards those high-risk case management older adults, but it might be a really great opportunity to explore what it could do for a different population as well.
That sounds wonderful. Maybe that's something too, Kyrie, you can help us figure out timing or individuals maybe to present more specific information about that at a future coalition meeting.
Yeah, I'd be happy to, once I have more information. Yeah, it's still really in the early stages of what they're developing, and I'm working with them on that project. But yeah, once they have something more fully developed, be happy to get you connected.
That'd be
with
great.
that.
Thank you. Thank you for sharing that.
Yeah.
Anybody want to share verbally input on this, or should we move on? Okay. This is another very specific question from Medicaid. Have providers considered how they could use ARPA Hcbs funds for the HIT and remote monitoring grants in their service models? So, you know, if, please describe, just meaning, you know, if you have questions, if you haven't, if you don't really understand this, which when she sent it to me, I said, I don't even know what that means. So post any comments here where you would like more information or you'd like to inform Medicaid. I think she sees this as an opportunity to access funding to help support, you know, some strategies with workforce issues. So if you have any comments that you want to get back to Medicaid, please post it here. I'm going to go ahead and move forward. If people have something verbally they need to share, just interrupt me. But I'm going to go ahead and move forward since this is kind of a specific thing, and I don't want us to run out of time. Please do provide feedback just to give us an idea of if you're using them, if you're not, if you need more information. So the last two slides also are just to kind of get some feedback from folks from, please share any comments about how ICIE and partners, could support you most with any challenges you're experiencing with the workforce shortage. We would benefit from working together to really understand what the issues are and collectively try to strategize and make the most of the resources that are out there. And so it might be Medicaid, it might be VR, it might be Department of Human Services, Department of Aging. It could be us as a coalition who supports information sharing, research, communication, that kind of thing. But anything that you would like to share about what you think we could do to help support this as an issue, so you're not dealing with it alone. And it doesn't have to be limited to providers. It could be educators. It could be individuals, parents, family members. Let us know what you need if you think there's a way we could support you. And I'm going to go ahead and just jump to the last screen as well, which is what would you like to see included in coalition meetings in the next year? So we have our dates that are set. At the beginning of the meeting, I mentioned that we'll do February virtually. So it will be another online 2.5-hour meeting. But we're hoping to have in-person meetings in May, August, and November if it's appropriate to do that at that point. So we'd also like any feedback you guys have about what you think would be helpful, what you would like to see us include in meetings for next year. So feel free to go ahead and add to that. And I am going to go ahead. Is it anybody have? I'm going to go ahead and stop sharing right now. Is anybody have any kind of verbal recommendations on those last 3 slides that they'd like us to capture right now, if they're not able to put it in the chat or on the Jamboard? Okay, feel free to reach out to us too. Oh, we've got a raised hand. I cannot see whose hand is raised. Jess, can you see that? I just see that there's a hand raised.
I think it's just Lynn's.
Lynn, is it your hand?
Sorry, I must have hit that by mistake.
Okay.
I'm trying to figure out how to get it down.
No worries. As long as I know there's not somebody who's waiting on me. So I think what we'll do now is we'll just open this up for, please continue to put comments on the Jamboard or in the chat, but let's just open this up now for any announcements. I'm going to go ahead and start with APSI, and then Drew will go to you for workforce, and then any other partner announcements folks might have. So APSI, do you have any announcements for folks?
We sure do. Hi, Amy.
Hi, Nicole. How are you? It's good to see you.
Good. Yes, let me just pull up my notes really quick. I have them hidden, I guess. So this past week, we had the opportunity to meet with our board at our strategic planning retreat and plan out our next year. So we're super excited about those initiatives, and those will be coming out soon. We do want to welcome our new board members, which Jess Crejo is one of them, Steve Gilroy, and Katie Woodward. So we're excited to have some new board members with us and some new ideas, new collaborations. So that's exciting. We want to remind everybody about our ACRE training series. Those dates are up on the website. We're coming back in person. So in the spring and the fall, we will have in-person training sessions in Des Moines. We are working on nailing down a location. We're thinking the Polk County River Plaza, but that will be out on the website as well. So big deal, face-to-face, yay. And we are going to kick off in January, on January 18th, our first ever public board meeting that we will be inviting all of our members to attend via Zoom, and our members can look for that link to come out here in the next few weeks.
Yay, that's exciting. Thank you for all the wonderful work with APSI. We have a kick-ass state chapter. But could you edit that out, Jess? Thank you. Any questions for Nicole? That's super exciting. Thank you so much. All right, Drew, do you have anything you want to share? Good to see you.
Good to see you as well. Can you hear me okay?
Yep.
So, as you probably last know, I was probably speaking to all of you from Job Corps. So I made a transition over to Iowa Works this past January. So I've worked a lot with unemployment for the first few months, and then we started full-fledged in my actual position, which is the business marketing specialist here at Iowa Works. So I was happy to see that our information was on that new page that's rolling out, the TLC, yep. And also Job Corps information. So, and I think there's just a couple things that I want to, I think this would be good for us to be added to this in the future. So this is National Apprenticeship Week. So I think when we talk about secondary transitions, the big push is creating apprenticeships, whether that's at the high school level with Future Ready Iowa or at the employer level. Being with businesses out in the communities, I think the biggest thing that I'm hearing from businesses, how do I connect with youth? Obviously, career fairs have gone by the wayside. Schools don't really have those anymore. How do we connect with our youth? And I think just from what I've seen in the past too with my own position, I think that's a big barrier and a big challenge that we need to kind of come together to maybe see how we can incorporate more of that. So whether that's through like the work-based learning in the high schools, getting those students out to those businesses, getting them into apprenticeships, those are the things that could take place of a community college certificate as well. So I know our big thing here at the Iowa Works office that we have across the state is we just don't have people coming in our doors either. So, when people say they can't find people, we don't have people that are coming through our doors as well. So what I think I want to highlight for everyone out there is make sure if you have people that are looking for help with employment, if you're looking for help with your resume, if you're looking for help just seeking jobs, that's why the Iowa Works offices are there. So we have classes to help build the resumes. We have bring your A game, what to say in your interview, all that stuff, mock interviews, all that stuff is available to you. Everybody, whether you pay taxes or not, who wants to find employment. So, and I like to highlight too, we did our ND National Disability Employment Awareness last month, and we did go over quite a bit of information as far as what can be done. So if you have employers that want help with paying wages, our Title I partners are those like CFI here in our office. They're the ones that are paying portions of hourly rates to employers that might need some of that assistance, or if they're doing some training on site. Those are the things that we house here, along with local rehab counselors, connecting them with that, and just kind of the referral process that it takes to get those individuals in the right direction. We all know, Workforce Innovation Opportunity Act was signed into law 2014, and the pandemic has gotten us to make sure that we are also getting into compliance with the national workforce. So so I will send out those links to you guys if you want to pass them on. It's just informational stuff. We did a lunch and learn and stuff like that. I was trying to think. So, and then also there is the podcast. I don't know if anybody's heard of the podcast through Iowa Workforce Development. It is amazing. All kinds of information from, what outlets are out there, what education, what job training assistance, all those types of things are out there. And it gives you so many more ideas with what's happening around Iowa. So, and then IJAG, I know is kind of at a growing point where they are a good resource for students who might need that extra assistance, that travel from the high school to their next secondary option in life. And they also get that work-based learning, that work assistance, all those career readiness skills in the high school curriculum. And what I'm learning is sometimes those positions that are at the school level are also, either half by the school district or half by IJAG, a third. It just kind of depends. So if there's a position that a high school or a community is looking for that might need some of that additional funding, that would be a good thing for them to add to their school. So other than that, I think I've covered most of what I can. I'll put the podcast links, our communication for our offices through Iowa Workforce Development. And again, just send them to our office locations. So, we just need people walking through our doors so that we can help them.
That's wonderful, Drew. Thank you. It's great information. And we'll make sure too to share out anything you give us to the coalition as well. Good reminder to say, use us. Do we have other partner updates? No? All right. Well, I just want to thank everybody for taking time to come and join us today, and for all the wonderful information people shared. I so appreciate your time and your investment, your willingness to come together. And I am excited to hopefully see you all in February of 2022 and in person in May, I hope. Please still feel free to take some time. We'll hang on for a little bit if you have anything you want to chat about. And we also will keep the Jamboard up, and you can still access that through the link. We will make sure to share all the materials. We know that some of you had difficulties accessing them through the Google Drive, so we will share all of that with you. And so thank you all so much. I hope you have a healthy, happy holiday, restful season. And thanks again. Good to see everybody.